Hi, everyone. Welcome to our Module 13 lecture. In this lecture, we will cover the topics of athletic injuries and psychology, addictive and unhealthy behaviors, and burnout and overtraining. Now, to start, I don't think I need to spend a lot of time on reinforcing the fact that injuries in athletics are very common. Just spend some time, look at these statistics in combination with the statistics that you may find in your textbook. And I think very easily, based on probably what you already feel, you can start painting a picture for yourself of how common and how prevalent injury really is in athletics. Why does injury happen? Well, we have various causes of athletic injury, and many times these causes kind of intertwine with one another, and it's almost hard sometimes, depending on the injury, to pinpoint just a specific cause for the injury. But to keep it simple, we can say that we have physical factors, we have social factors, psychological factors. We also have personality factors and varying stress levels that all play a role into what can cause injury. So I want to start here. I want to start by showing you a quick video from Dr. Britton Brewer, and he will quickly discuss, in his point of view, the relationship between, especially what we're interested in, at least for our course, the psychological factors and some of those stress-related factors, and even personality factors, and how they impact injury. So let's check it out.
Are involved in injury rehabilitation in several important ways. First of all, psychological factors may contribute to the occurrence of the injury in the first place. Second, injury often produces psychological responses, such as cognitive responses, emotional responses, and behavioral responses. And then those responses to injury in turn can influence athletes' recovery from injury.
In what way can psychological factors contribute to an injury?
Psychological factors can contribute to injury in terms of providing stress that makes athletes more vulnerable to injury, distracting their attention from what's going on in the course of their sport involvement, and making their muscles tighter and more susceptible to injury. So basically, psychological factors are risk factors for injury.
And what Dr. Brewer touched upon in the video, something that we're going to talk about later on in today's presentation, is the fact that different psychological factors play a role as well throughout the rehabilitation process. And myself, as an athletic trainer who's worked with countless numbers of athletes, I can tell you that is very much the case. And I'll share a little bit more about my experience once we get to that section of the presentation. So in order to really understand kind of what we're discussing as it relates to different psychological factors playing a role in injury as precursors, sort of risk factors for injury, as you heard in the video, the fact that these different psychological conditions cause stress, leaving athletes more vulnerable to injury, that's what we're talking about when we talk about the stress-injury relationship. I think it goes without saying that athletes that are in that heightened stress level, that heightened level of arousal, in which you're not able to cope appropriately, not able to act appropriately, they do have more injuries. Typically, we start to see that majority of what we see is that negative stress causes, or we could put it as negative life stress events, cause injury or lead to injury or a correlative injury. But again, also positive life events can also cause an abundance of stress and injury. And why is that the case? Well, remember, when we talk about stress, there's obviously good stress, bad stress, and it's easy to think about how negative stressful situations could lead to potential injury. Well, if there's a positive stressful situation, getting married, getting a new job, which is again a life event that potentially is causing your attention to waver or leading to a lack of preparation, those are still things that can contribute to injury. So it doesn't necessarily matter when we talk about life events what the life event is. The fact is that if the stress induced by the life event is something more than the athlete can cope with, then of course that serves as a risk factor for injury. But that being said, it's not always that clear cut. You think about all the other factors that we just mentioned earlier as it relates to physical, psychological, social, stress related factors, obviously, those obviously can play a role as well in this relationship. So it's not as clear cut as heightened stress, you will get injured. A bunch of other things have to happen many times for that injury to actually take place. Important things to note is that what the research tells us is that the greatest stress sources for injured athletes were actually the psychological ones, not necessarily the physical aspects. That becomes really interesting. So based on what we've discussed throughout the semester, if we know that stress, heightened stress levels, is a huge precursor, sometimes bigger than physical risk factors for injury, then it makes sense that we incorporate psychological skills training and we've said this before, in the routine of athletes. And it's also important to note that something like stress management, various stress management techniques to lower anxiety, both physical anxiety, cognitive anxiety, even mixed methods of that anxiety, that's key. And if you recall, when we talked about things like, using imagery, muscle relaxation, counting, these are all specific tactics that can be done, before performance, during performance, and even during practices to lower that stress, lower that anxiety. Some other things that I just want to point out here that relate to that stress injury relationship. Again, think about why this really does happen. Well, it really does happen primarily because, again, we have that attention disruption. We spent some time in the concentration content of the class talking about how when an athlete has their attention capacity kind of spread out among different things, right? That maybe they're unable to multitask in their mind, or they have too much tunnel vision, they're focusing too hard on one thing, or they're not able to put their thoughts where they need to be, then we get a disruption. So of course that can lead to injury. We can have various physical reactions that come with stress, and those include things like not just coordination, concentration, but of course heightened muscle tension, generalized fatigue, muscle efficiency, reduced flexibility, motor coordination problems, and movement patterns. And think back to, I think I used this as an example in one of the earlier module lectures, but if you consider a cross-country runner who, has really good form in practice, they're able to run with long strides, their upper body looks relaxed, looks in coordination where it needs to be in order to maximize the technique of running. But when it comes to competition, that same runner has a high degree of anxiety, has a high degree of stress. That stress builds up and potentially leads to that runner running with heightened shoulders. So what that means is that physically, there may not necessarily be anything that's the root of that problem per se, but what's happening is psychologically, cognitively, that stress is causing that physical reaction. So that would be an example of how, over time, let's say if that stress continues and that increased muscle tension leading them to run with elevated shoulders happens over a period of time, over a season, then you could see injury. In that case, most likely a chronic type of injury. Some other things to consider as part of exactly how that psychological stress continues to impact the physiology of the body. Well, as people get stressed, certain chemicals get released. And again, what ends up happening is there might be a likelihood of injury. There might be a likelihood of, or I should say, lack of being able to heal appropriately. We start losing out on things like growth hormone, which again help during the injury process, particularly after an injury has taken place, injury recovery process. And then, high levels of stress can interfere with chemicals in the body, which also further contribute to sleep disturbance, which again, do add to recovery. So what we're saying now here is that not only does intense psychological stress, athletic injury stress, or I should say just stress in general from the psychological side of things, serve as a risk factor to injury, but also now we're starting to see that there are significant factors, psychologically speaking and physiologically speaking, that come from after an injury takes place. There's a part of the text, and I could spend a long time talking about concussions, but there's a part of the text that dives into concussions, and rightfully so. So, originally I had a lot more information on concussions here, but I think, there's a lot that you can read about. And obviously, this is something that comes up in a bunch of the other classes. But I will say this about concussions. Concussions are obviously referred to as the invisible sport injury. And we define a concussion as a complex physiological process that affects the brain, and it's usually caused by biomechanical forces. So if you think of the brain sitting, and I'll just draw this out for the sake of drawing things out here, but if you think of the brain sitting within the skull, here's your wonderful skull, here's your brain. What a concussion is, based on the definition I just gave you and some of the things you see here in front of you, is a reaction of impact, whether it comes from the front of the skull, the back of the skull, different sides, whether it's a forward whiplash mechanism known as a coup mechanism, meaning that the brain impacts the side of the skull where the impact took place, or maybe it's a backwards whiplash mechanism, a contra coup mechanism, which just means that the brain impacts the opposite side of where the skull took place. The brain is moving around. You think about what's in between the brain and the skull. Obviously, we have cerebral spinal fluid, which not only helps provide nutrition to the brain, but also helps to cushion the brain. With a concussion, the forces that occur are happening so fast and so strong, or they're happening strongly, so that cerebral spinal fluid is not enough to cushion the brain, cushion the impact. So it's a brain injury. It's a significant injury that does not, if not healed properly, can lead to at worst pretty significant, sometimes fatal situations, such as second impact syndrome, something I'm sure you might have heard of before. Second impact syndrome being when an athlete or anyone sustains a concussion and it's not healed within an appropriate amount of time, and they return to activity. And then they get a second concussion before the first concussion heals. It's sort of like stacking a concussion on top of another concussion. So when it pertains to our course, it's important to know that we need to, and we touched a little bit upon this earlier on with some of the other topics we talked about, but it's important to know that even if an injury is, and you can apply this to other quote unquote invisible sports injuries. So you think about a lot of mental health injuries. Even if an injury is not physical in nature, not something that can't be seen, it cannot be taken lightly. And you still have to think about all the other factors of psychology that come as a means of that injury taking place. So if we go back here just a second to what we were looking at earlier, these things will still happen even with an invisible injury. And the problem with concussions is that there are so many signs and symptoms. It's very rare. Anytime you read about concussions anywhere, you're going to find a extensive list of signs and symptoms. And I'll name just a few, but there are many, many more than the ones I'm about to name. You think about various physical symptoms. You think about things like sensitivity to light, sound, headache, nausea, vomiting, dizziness. You think about different cognitive symptoms, difficulty concentrating, difficulty with memory, just feeling like you're in a fog, feeling like you're out of it, and obviously different types of emotional behavioral symptoms. People that cry extensively, people that get really irate, especially when it's out of their character. And the thing that's interesting about concussions is everyone heals differently from them, and you focus on the symptoms. Something that we've come away from, especially in recent years, things that people used to do are grading concussions, right? People used to use terms like mild concussion, moderate concussions, severe concussions. We don't grade concussions anymore for a couple of reasons. And I think more importantly, more practically, I think it's good that we don't no longer grade concussions, because when you say something like, oh, player A has a mild concussion, just that word mild takes away from exactly the severity of it. So in other words, a mild concussion is still a pretty significant, at times severe injury, because at the end of the day, it's still a severe injury. we can say someone has mild symptoms, moderate symptoms, severe symptoms, but that doesn't coincide with the grade. I mean, they used to say things like grade 1 concussion, grade 2, grade 3 concussion. We don't use that terminology anymore. Concussion is a concussion, and what does change in severity are the symptoms. And for some individuals, within a day, their symptoms subside. Other individuals, they take a week, a couple weeks, and for some, even months and maybe even longer. But I would say, for the most part, on average, what you do see is about a week of a recovery from a concussion, particularly if it's, someone's first concussion. And based on that finding and based on that research, that's where, and we're not going to get too much into it for the purposes of our course, but that's where the whole idea of the return to play progression, and I'm sure some of you have heard of this before, where you have to, once you sustain a concussion, you have to go 24 hours without symptoms, and then you might do something like impact testing or some sort of other form of baseline testing to make sure that your certain capabilities are up to where they used to be and that you have no signs of symptoms. And then you go through a progressive day-to-day program in which you can only progress once you have no symptoms. Something else, and then I promise we'll move on, that we no longer assume or know about concussions or believe that we know about concussions is the fact that someone doesn't need to lose consciousness to get a concussion. Not that long ago, that's what they used to believe in healthcare. They used to believe that you'd have to lose consciousness to have a concussion. That is not true. So that's just one of the many myths. Another myth that used to be out there is the fact that you can't sleep when you have a concussion. That's not true. You want to get the appropriate amount of rest. There's nothing wrong with you sleeping, after you have a concussion. These are things that, over time have, for the good change, but at the same time, it's important to realize that concussions are still a significant problem, not just in elite sports, but really, in any sort of competitive and recreational environment. And, us as, individuals that will work with athletes, moving forward, we need to remember that we need to give as much weight to concussions and other invisible sports injuries that we do to perhaps, a broken bone or a sprained ankle or dislocated shoulder. So kind of talking a little bit more about what happens as a result of athletic injury. We mentioned how, there can be different chemical reactions, which again impede the healing process and perhaps make it more difficult for that athlete to go throughout the entire injury recovery process. But psychologically, for a lot of athletes, particularly athletes that have a high degree of athletic identity, which we're going to touch upon today, they are very emotional. And I think many times you understand why, particularly if it's something that, their sport is something that means a lot to them. And for a lot of the athletes that we work with, that we will work with, this becomes very true. So I'm sure you've heard of the 5 stages of grief: denial, anger, bargaining, depression, acceptance, and reorganization. Now, although when we talk about sports injury, many times we're not talking about a death, we're not talking about losing a loved one, hopefully it's not a fatal, a life-changing incident, it's still something that someone can work with. But regardless, the amount of grief response is based on the perception. I'll give you a classic example. So, think about the high school setting and think about a situation in which you have a high school senior who, isn't going on to play sports in college, but loves that sport. And they have worked very hard to get to where they're at. And then, halfway through or in the first game of the season of their senior year, maybe they tear their ACL or they tear some specific ligaments in their ankle and are not able to continue for the remainder of the year. On the grand scheme of things, it's an injury. It's very likely they'll have surgery, they'll be okay. Their future wasn't contingent on, or aspects of their future wasn't contingent on that injury. They weren't going to compete in college anyway. And they, they're not going to lose their limb. They're not going to lose their life. But in that moment, particularly early on for that individual, that's a really big deal. Let's say if the injury happens at first, they try to deny it, they try to play through it, or they try to stand up and say that, it's not really a big deal. And then obviously once they realize what has happened to them, maybe they try to move, but they can't. They go through significant anger many times, particularly again, if they have a high degree of self-identity. Um, maybe they try to bargain wherever possible. Maybe they try to say something along the lines of, oh, if I get surgery now, maybe I'll be back before the end of the season, even if it's unrealistic. Maybe I'll be able to do this instead of getting surgery and make it through. Even if it's unrealistic, they're looking for things that they can do to bargain their injury. Once they realize that they're no longer able to bargain and they have to continue to accept the fact that maybe they will miss the whole season, they probably will. They're obviously going to be very upset about that, and they're going to go through various stages of depression. And then ideally, hopefully with the appropriate coping mechanisms, they get through the fact that, although it was something that, hurt them emotionally, they accept what happened and they continue to look at their life and look at their body on a larger scale, and they put in positive thoughts into their rehabilitation process. They put in the work, and then they're able to continue on to the next stage of their life successfully. And that's just one of the many examples that exist in sport of athletes going through a grief response and treating their injury, as I don't want to say as severe as the loss of a life, but depending in the circumstances, for certain injuries and certain athletes, some for them, especially in the beginning, they feel the weight of what they feel sometimes is on par with that, even if it's just for a short while. Other things that we see, other reactions, and I kind of alluded to a lot of these when I just kind of went through that example of the grief process. There can be a loss of identity. For instance, if someone is a basketball player in college and they live, breathe, and eat basketball, right? They spend all their time playing basketball, watching tape on basketball, watching basketball on TV. Maybe they're playing video games with basketball. They wear all the gear. It's part of their identity, and they love doing it. But if they're injured and they can't participate in basketball, and they don't have any other outlets that are now basketball related, they may struggle. And then they feel lost and they start to lose out on aspects of their own self-identity. Of course, once someone is injured, there's always that fear of them not being able to recover, particularly if it's a reoccurring injury. You think about all the athletes you've heard of, and unfortunately, maybe some of you fit in this example as well, but you think of athletes that maybe, have a significant knee injury, maybe they tear their ACL and then they spend a year recovering, and then they come back, and then they have, let's say maybe not as serious, but maybe they end up getting, patellar tendonitis on the other knee because of their compensations, and they're constantly in pain and they're anxious and fearful that the same thing that happened to one knee is going to happen to the other. So you can expect that, re-injury fear and anxiety is a significant thing. And then the one interesting sentence that I put up there for you is, particularly if there's a high degree of self-identity with that sport for the athlete, once they're injured, aside from maybe their rehabilitation that they might be working on healing that injury, they're free, their time frees up significantly. So they're often on the sideline, they're watching, if they're not practicing and not competing, not being an active individual during practices, then free time becomes sometimes much of a burden, because instead of maybe using that free time to do something productive, they're using that free time to build that fear, build that anxiety. You see this a lot in high school, particularly where the high school athletes that are injured don't always come to the practices or come to the games, where their teams are still in, and that says a lot of things. But sometimes if that's done a lot, meaning that they're missing out on a lot of those activities, then it begs the question of what are they doing when they're not there, and is it something that's productive, or is it something that's impeding the healing process through a negative injury reaction. We also see, generally speaking, a lack of confidence. That's not uncommon to see. particularly, again, I highlighted their additional injury because the athletes overcompensate. Again, if someone is constantly in pain or doesn't feel right, even, as they recover, there's definitely going to take a hit to their confidence. And sometimes if expectations are too high, especially if, expectations are very high to begin with, then that becomes very difficult to meet. And you see this a lot in professional sports where, great athletes are injured and then they feel a lot of pressure to, be the same as they were before, if not better. And if they don't meet those expectations, obviously they get very hard on themselves and they potentially start to not only lose their confidence, suffer some of those other things we just talked about, but definitely have an increased performance decrement. And then lastly, I think something should be said about the group processes thinking of injury reactions. It's not uncommon to have injuries that affect one athlete, but really start to affect how a group functions, whether negatively or positively. I'm sure you've heard many times where, an athlete goes down with a really significant injury, at worst case scenario, a fatal injury, an injury that takes them out for an extended period of time. And then the team rallies around that, right? Puts forth a little bit more effort, uses that as motivation. Or, other times you see the opposite happen where, an injury happens to a player in a team or a group of players, and the team is pretty distraught about that. So they're not able to positively embrace the injuries. Instead, they, really suffer negatively from, their group processes, the things they do on a day-to-day basis, even if the injury is not to some of those individual players themselves. So as an athlete has an injury, again, because injuries are common and injuries will happen, it's important to look for signs of poor adjustment, because again, a big part of being a coach, being a teammate, being an athletic trainer, being a sports psychologist, being around athletes, both when they're trying to perform at their best out of injury and even when they're injured and trying to recover from injury, you need to know what are your capabilities as a provider, as a helper, and when do things exceed to the point that you may need to include some referral plans in what you're looking at. So the things you're looking for are excessive feelings of anger and confusion. Of course, some of that is expected, but when it becomes excessive and pronounced for a period of time, you think about the stages of grief. Someone is not progressing through the stages of grief appropriately. That also goes with, you see denials on there. Someone doesn't move through those stages, then that could be a sign of poor adjustment. Someone constantly questioning when they can return instead of focusing and buying into the process of their rehabilitation. This is something that you see a lot. Coming back too soon, experience re-injury, not giving themselves appropriate amount of time to heal, to play successfully, or if they constantly talk about things they've done in the past or things that they will do, to the point where it's not humble, it's bragging. So imagine someone in the rehabilitation process always saying things such as, remember when I score these many points, or I'm going to score X amount of points, or I'm better than all these players even without my injury. And again, part of that is good in that a little bit of that can be self-motivation to keep that self-confidence. But too much of that, of course, like we talked about with confidence, leads to overconfidence, and really bodes to explain a potential reason or show one of the signs where there's poor adjustment taking place for that particular athlete. Some other signs that we see: someone becomes hyper aware of their body. So, anytime someone, in rehabilitation is, has a little bit of discomfort, or maybe they're trying to work themselves back in after an injury, after practice, and they get a bruise that's not that serious. They start to really worry about those minor things that maybe in the past they weren't worried about them. They feel worried they wouldn't be worried about. They start to feel guilty about letting the team down. They start to kind of draw away from significant others, teammates. loved ones, coaches that they used to be really close with, professors, athletic trainers. They start to have differences in their relationship with them. Sometimes they come into the athletic training facility or wherever they're doing the rehabilitation in a really good, happy mood. Other times they're very down on themselves, and they can change on a day-to-day basis. Or when they give statements that they are ultimately not ever going to be the same, or that no matter what is done, recovery will not occur, or they'll never be back to 100%. Again, those are all signs of poor adjustment. And what you see many times is that a lot of these signs, they kind of come and go. And usually the ones that come and go over a short period of time are not the ones to worry about, but the ones that drag out for a significant period of time and start affecting other aspects of their life. Those are definitely the signs that are more troublesome than anything else. Okay, so as an athlete goes through rehabilitation, it's important to know, or important to realize, that psychology plays a huge role. So obviously someone could get in to the rehab, do certain modalities. They can get game ready and ultrasound and whirlpool, and they can do all types of therapeutic exercise. They can stretch, they can do strength training, balance, proprioception, you name it, right? There's tons of things we can do with athletes in rehabilitation. But the body or the mind needs to be just right as well. Again, psychological factors play a huge role in injury recovery. I think about, and some of you may not know who this is, but I think about Derrick Rose, who plays for the NBA, and he's still in the NBA now. But a few years back, maybe longer than a few years back, almost close to a decade now, he used to play for the Chicago Bulls, an NBA team. And Derrick Rose was and still is, not as much as he used to be, but he was a tremendous athlete. He was very physical, he's fast, agile, and he sustained a ACL injury. And obviously, with the ACL injury, he completely tore it, so he needed surgery, and he was out for the whole season. And then he spent, all of his time becoming stronger than he ever was before. And by the time he finished his rehabilitation, the physicians that worked with him and the athletic trainers that worked with him, they told him, you're stronger now, on both sides, than you ever were before. Ever in your whole life, essentially. And when he came back, everyone noticed that he was playing differently. What I mean by that is, prior to his injury, he was aggressive. He would take the basketball, and drive into the paint all the time. He didn't care who was there. He was always very aggressive in the types of things he did. But now, when he came back, instead of driving in all the time, he would pass the ball more. He would take more outside shots, which, he was never that much of a great shooter compared to as much as he was a finisher around the paint. So he was changing his game. And naturally, what ended up happening, unfortunately, was he actually sustained another season-ending injury to his other knee. So that begs the question of, well, if he was physically stronger than he ever was before on both knees, how is he injured again so quickly? And the injury happened, when he came back, it happened a couple games, less than 2 weeks into the new season. Well, is a part of that coincidence and a probably part of that bad luck? It's possible. But another aspect, and an aspect I think we're more interested in, is, again, the psychology of it, and thinking about some of the things that, although in his rehabilitation he made himself as physically strong as possible, what did he do to prepare his mind? Did he do certain psychological skills training techniques that we've talked about? Did he prepare himself to be able to, compete the way in which he did before, all at the same time while trusting his previously injured knee and not compensating on the other side? Again, it's no surprise that, people that care for athletes in rehabilitation, and again, I'm speaking from the perspective of specifically certified athletic trainers, because that is who I am, there's no denying that you have to treat the psychological aspects of injuries, and they're just as important, if not more important, sometimes than all the physical aspects. It's important to note that an athlete that goes through psychological skills training, right? Think of an athlete that maybe is using things such as self-talk and imagery. Once that athlete's injured, it's not automatically you can't automatically expect that that athlete will use those techniques as part of their injury rehabilitation process. For them, they might just associate those things with performance, and the moment they get injured, they treat it as something else. But I got to tell you, some of the best athletes that have been the most successful in the rehabilitation aspect are those that use things like self-talk, goal setting, self-motivation, right? In buying into the rehabilitation process to the point where it's intrinsically motivated. Those are the individuals that really do have the best success rates. And something else that I put there for you that I think is really interesting to remember: physical healing does not necessarily coincide with psychological readiness to return. So that's another thing that I think coaches overlook a lot, where, and some of you may be, faulty of this as well. Maybe some of you that are, follow college sports and professional sports, when someone gets hurt, maybe one of the first things you think about, or one of the first questions you ask is, how long? When does that person come back? They get surgery, and then how long do they get back? Well, again, any recommendation in terms of how long a person may potentially be out for is just based on normalcy, right? On unexpected psychological readiness. So, if you think about someone that has a hamstring strain, which, hamstrings are very common in all sports, you think about grade 2, a moderate, maybe on the lower side, but still a moderate hamstring strain, someone could take somewhere between, let's say, 2 to 4 weeks to return, on average, ballpark. But if that person has recurrent hamstring strains, not only does that make you want to potentially be more careful with that person, but you have to work on the psychological readiness to maybe tackle the real issue as to why that injury keeps happening, regardless of the fact that the person has really strong hamstrings or has healed successfully. So the person might be completely healed 2 to 3 weeks after their initial injury, but then they are, again, doing things differently in practice, or they are, really worried about re-injury, so they have high degrees of anxiety. And if that's the case, then again, there's not that level of psychological readiness that has been met yet in order to allow that person to return to practice or return to games. Imagery specifically is something that has shown to be really effective. When athletes use imagery to recover in the injury recovery process, they are more likely to be able to set better goals, to relax during rehabilitation. Even when it comes time to perform again in practices and games, they can control their anxiety, particularly re-injury anxiety. They can motivate themselves in rehab. They can maintain, and as we heard with motivation, as we learned with motivation, the more motivated people are, the more likely they are to adhere to a rehabilitation program. I want to just kind of just quickly talk about the research that I'm currently involved in. So I'm currently looking at the effect of depression and anxiety on sports rehabilitation adherence and injury recovery. So I'm interested in seeing, is there a relationship? And we know there is, but obviously the study that I'm looking at wants to dig a little bit deeper into this piece of the puzzle, if you want to say, the psychological side, the psychosocial aspect of injury puzzle. So I'm interested in trying to figure out, do symptoms, or how symptoms of depression and anxiety affect how well people stick to their rehab programs after injury. Obviously, I'm using different questionnaires to measure not only their level of symptoms, both at preseason, during this, during, or I should say, during the season after an injury has occurred, and then obviously once they are completely cleared for sports activity. So those are the 3 points in time in which I'm measuring their symptoms of depression and anxiety. And also at the same time, once they have sustained an injury, I'm measuring rehabilitation adherence, particularly, on the day that they are cleared for sports participation from both the perspective of the athletic trainer and the perspective of the athletes themselves. So ultimately, I'm asking questions such as, are more depressed and anxious athletes less likely to adhere to the rehab, and do they take longer to recover? I'm also asking questions such as, are athletes that display higher levels of depression and anxiety at preseason, so baseline before the season starts, are they more likely to get injured throughout the season? So again, those are things that I'm looking at right now, working with different collegiate athletes, and that I'm interested in finding. So not to get too off track, but something else that we can look at are, different things that can be done in the rehabilitation to help increase adherence to sports injury rehabilitation. So, obviously in my study that I just mentioned, I'm looking at different universities as well, particularly a Division II and a Division III university. So something that, I may find and have to consider is one environment may have more of these things than the other, and that could potentially influence, and it potentially will influence adherence. That includes things as personal attributes, right? The particular athletes at that institution, at that college, environmental characteristics. Obviously, in my study, the people kind of guiding the athletes through this process are certified athletic trainers. So what are the differences about the athletic trainers at each institution that are leading the rehabilitation process? How capable is the actual athletic training facility? How easy is the scheduling of appointments for the athlete? Are there these skills that we've talked about, these psychosocial skills, psychological skills, training skills used during the rehabilitation process at one place versus not the other? Again, that could change things. And ultimately, things like self-efficacy, personal control, emotional distress, treatment efficacy, perceptions of injury severity all play a role as well. So some general recommendations that exist in terms of coping with injury. Recommendations for athletes include things such as, maintaining a positive outlook, setting goals is huge, goal setting is huge, and again, adjusting goals appropriately as needed. Recommendations for coaches include things as making sure that the athletes remain part of the team and are involved in some capacity, even if they're not necessarily on the field or on the court during practices or games. Coaches need to be understanding of injury. Some coaches are obviously better than this than others. But ultimately, I think the biggest thing to get here is when we talked about relationships and team dynamics early on, we know that the coaches that foster that relationship with their players that extends beyond just what you can do for me on the performance side, those are the ones that can help a little bit more and are able to help their athletes cope a little bit more with their injuries. And then on the side of athletic trainers and other sports medicine personnel, keeping their athletes with a positive mindset, adjusting goals as necessary, being confident, never lying to athletes. One of the worst things you can do as an athletic trainer or other rehabilitative specialists is telling an athlete, hey, you'll be back X amount of days when you can't actually promise that, or when it's completely unrealistic. Because what happens is if that goal is not met, if that timeline, even if it's unrealistic, is not achieved, then that takes a significant shot at the athlete and a shot at the athlete's confidence, and the athlete begins to blame his or herself. So you never want to lie to athletes. You want to be truthful with them, be positive, but at the same time, keep them educated, keep them informed, let them know exactly what's going on in their body and what they should expect as they go through the rehabilitation process. Okay, moving on here. The next part of this presentation, we want to quickly just talk about addiction and unhealthy behavior. So we're going to talk about things such as anorexia, other types of eating, just disordered eating, bulimia, gambling, we'll talk about for a short while, those kind of things, and just how they, some research behind them, how they, of course, impact sport and exercise, and how to hopefully make sure that our athletes are not falling victim to these unhealthy behaviors. Some examples I have for you, I think some examples that are probably, unfortunately, ones that you've heard of, you read about, you experienced, hopefully not, but maybe you've experienced with people that you know firsthand. They're similar to what you see here. So, spend some time, just read these examples. Some of these are pretty recent, and others of these you can imagine are much more significant than others. And some of these impact much more people than just the individual person himself or herself. Okay, so hopefully those are good examples to drive the point home. So let's go through these. We have anorexia nervosa. Anorexia nervosa, typically just named or called anorexia, psychological disease characterized intense fear of becoming obese, disturbed body image, significant weight loss, refusal to maintain normal weight, amenorrhea, which is a pausing of the menstrual cycle in women. And typically what we see with anorexia nervosa, a weight loss of 15% below normal. So, significant weight loss. These types of individuals, they don't want to gain weight. They don't want to be fat, even though they are already really thin and below weight. They have significant disruptions, or I should say disruptions of their own body weight, size, and shape. Every time they see themselves, they're not going to be happy with what they see in the mirror. And then, kind of going back to what I just mentioned with amenorrhea, in females who have anorexia nervosa, we start to see at least 3 consecutive expected menstrual cycles start to dissipate, start to not be there, not be as much in strength, but also in occurrence. And then once that continues, that's classified as amenorrhea. Bulimia is an episodic eating pattern of uncontrollable food binging followed by purging, and is characterized by things such as knowing that it's abnormal. So in other words, people that are bulimic typically realize that what they're doing is unhealthy, but they do it anyway. They, can't get themselves to really stop eating appropriately. And because of that, not only do they feel as if their bodies are not the way they need to be, should be, they get really down on themselves, and they're forcing themselves to vomit, whether using laxatives, diuretics, strict dieting, fasting, or they're just doing whatever they can to, once they eat a lot, they're trying to get rid of that amount of food in their body as soon as possible. So, some clear differences there between anorexia and bulimia. But I think some similarities that we do see are, again, that over concern with body shape and weight. And obviously there's a lot more I can say about these 2 disorders, but just to keep it at least simple for our purposes, to kind of make sure we get all the content that we need to cover. I'll say this, that, I've personally had some experience, working with individuals who've had anorexia nervosa. And, one of the things for me, early on, and, probably the best example that I'm thinking of is probably one that occurred, 7-8 years ago, where, I remember a situation where, I was working with, a young woman, and she, was making progress, right? She had an intervention plan, she had a food diary, she was doing everything she needed to do. And then I remember I was out at a diner with her and some other people, and she ordered a salad, it was like a chicken Caesar salad. And she said no dressing on the salad. And then when the waitress brought back the salad, it had dressing on it. She was, very apologetic. She said, "Oh, I forgot to tell the chef, no dressing on the salad." And I remember, someone we were with turned around to her and said, "Hey, we can just tell the chef, we can just send it back, tell the chef to make another one, no dressing, not a big deal." But she felt, the person who had anorexia nervosa, so bad about the fact that people had to, in her eyes, go out of their way to do that for her. And the fact that she couldn't get herself to eat that dressing with extra calories, because her mindset was she was going to go in there and get a chicken Caesar salad. And this had thrown a curveball in her plans. She had a significant mental breakdown, and she started, crying. And, obviously, unfortunately, everybody was staring, and some people were confused, not understanding what was going on. Needless to say, it became a really big situation. And I think in that moment, and, back then I didn't know nearly all the things that I know now. Not that I, am by any means an expert in this field, but, I realized in that moment that, this is a situation that, you have to tackle from a team approach. If you encounter athletes with these types of conditions, and not just these two eating disorders, but some of the other things that we're going to talk about, other unhealthy behaviors, addictive behaviors, it takes a referral many times, but it does take a team approach. So, think about teammates and family members and friends and coaches, someone that is really embedded in this unhealthy behavior, whatever the unhealthy behavior. It's really a team approach to help that person. That's going to have to be the thing that really helps them understand what's going on with their behavior, and really helps them ideally come up with a good intervention plan to help them go through it. So again, hopefully I didn't bore you with that story, but hopefully it does give you some insight. And if any of you have experienced anyone, whether it's someone very close to you, whether it's you, and that is a possibility, and hopefully you did get through that. You understand that it is a team approach, and that it is something that cannot be understated, because it is significant. And kind of going off the trails of that with disordered eating, that's different from from a definition standpoint. That's different from anorexia nervosa and bulimia. Obviously, anorexia, bulimia, or anorexia nervosa and bulimia are specific types really of disordered eating. But when you have some pattern that doesn't fit that definition, we have other things that fall within the spectrum that aren't, on one end anorexia, on the other end bulimia, somewhere in between. We use this term. So we often use this term when you have potentially the psychological symptoms of an eating disorder, but no official diagnosis. And it's also important to note that disordered eating is not just prevalent in females. It occurs in males just as much. Or I don't want to say, depending on circumstances, many times not just as much, but it's not uncommon, I should say, for this to happen in males. And just some statistics to throw your way. Lifetime prevalence of bulimia is 1.5% in women, 0.5% in men. Lifetime prevalence of binge eating disorders is 3.5% in women, 2% in men. So again, not as common in males as females, but it does happen in males. That is important to note. Binge eating is more common than anorexia or bulimia, and it's more commonly associated with severe obesity. I think that makes sense. And sadly, especially with, I think, the change in the amount of foods that are available, and the change is in social pressure, changes in society for a couple different reasons. We have seen a growth in various eating disorders, particularly more than double since the late 1960s. So why do these things happen? Well, there's a lot of reasons why they happen, similarly to why there's a lot of reasons why injuries happen, particularly athletic injuries. We can look at internal factors, external factors. Internal factors include things such as negative mood, self-esteem, exceptional desire to be perfect. There's a lot of research that shows that, a lot of eating disorders are associated with sports that are very much tied into the physical appearance of the athlete. You think about gymnastics, cheerleading, wrestling, swimming, right? A lot of those sports are contingent on the physical appearance of the athlete, or at least, from a societal perspective. So that, again, adds even more pressure for them to be perfect in that regard. And you can imagine how something like that does serve as a significant internal factor that can contribute to a type of eating disorder. And then again, we have external factors such as negative influences of self-esteem. If you have coaches, family members, so-called friends, teammates, constantly causing peer pressure, ridicule, saying things about body shape and sizes that are not appropriate or not desirable, that can be significantly hurtful. Other relationships, if athletes start to tie poor sports performance with their body shape and size, that could be significantly detrimental as well. Okay. Next, I want to share with you two really important videos, and I'm going to play them back to back because I think they're really, really important. They're from Dr. Dana Volker. And in the first video, she's going to talk about, from her perspective, an appropriate way to address weight issues with athletes. And in the second video, and they're both short videos, the videos I play are usually pretty short. Second video, she's going to address how to discuss an eating issue with an athlete. So let's go ahead and watch these videos.
Coaches talk about weight if they find that it's necessary. One of the things I always say is try to adopt a health first focus. So focusing on the athlete's health rather than talking specifically about weight. It is a big misconception that, the thinner the better, and that, the more size the better for men. A lot of times that's sort of the stereotype or the ideal. And that the relationship between weight and performance is really not what we think it is. So focusing on health and function above and beyond what the body looks like, I say, is a good, safe way to go. The other part is, being educated on healthy nutritional practices and exercise habits. And what I mean by healthy is something that is grounded in science about what we know to be really good for long-term athlete health, and not something that we just heard about. It's sort of like the new fad diet to sort of implement with our athletes, and really getting educated from scientific backgrounds.
Okay, let's watch our second video here. Again, now we're getting into her recommendations to address eating issues.
If you are a coach who is concerned about an athlete in regards to eating and exercise behaviors, you don't want to go up to them and say, well, would you just eat more because I'm noticing that you're not eating, because that's really placing a lot of blame. We don't understand the whole context of the situation. So what we generally recommend is to use something called caring confrontation techniques. So, you might address that athlete in a very private setting, confidential from the rest of the team, and just kind of sit them down and ask them how things are going, start to strike up a conversation. You want to be direct and confrontational, but that doesn't mean that you're overly aggressive and that you place blame on that athlete. You say specific behaviors like, I am observing X, Y, and Z. I'm concerned because I care about your health. Not sort of like, well, if you don't start eating, I'm not going to start you. That's not okay to sort of say. So I really care about your health. What do you think about that? And then give them a chance to respond. Be empathic. Be really open and let them talk. Once you kind of hear their perspective, start to talk about what you think might be appropriate and necessary steps to take afterwards.
Okay, good. So hopefully that helps. Again, that's, it's one of those things where that's easier said than done, but definitely important things to consider, if you ever find yourself in that circumstance, particularly working with athletes. So let's go here. Okay. So generally speaking, kind of summarizing some of the things that were highlighted in the video by Dr. Dana Volker. You should be supportive, empathetic. Healthy nutrition should always be emphasized. Healthy nutrition grounded in science, not through a fad. Referrals, when appropriate, need to be made possible. And, especially when there's significant disorders that are in question, there needs to be an ability to have some privacy. So, individuals shouldn't be signaled out. People who don't need to know, who are not professional, you don't need their input. You shouldn't be sharing, what you think with them when it's not appropriate. There shouldn't always be team weigh-ins, particularly when there are suspected issues of this nature or that are expected or are believed to be expected. And this is just the video that we saw earlier. And then some general recommendations just to kind of round out what we've been saying here. For coaches, focus on good nutrition, focus on fitness, not body weight. Again, there's not always a clear relationship there between body weight and performance in the way that we think. Understand that these are issues that are often sensitive to a lot of people. So you have to be cognizant of that as a coach. Hopefully, early on, throughout the season, throughout the year, the promotion of healthy management of weight and good nutritional habits are established. This goes back to what we said earlier in the semester about establishing good, healthy norms. Hopefully that's established. And then using aspects of the things we've talked about to continue to not only fight these disorders if they're believed to become an issue, or to hopefully prevent them and to maintain that healthy management of weight. General recommendations for parents, of course, be there emotionally, be sensitive. Don't, use it as a sign of weakness or, discourage it, just as you wouldn't discourage, a broken bone or a certain type of physical injury. You got to treat it with the same level of care. And, I think what's most important is educate yourself, and this kind of goes back to coaches as well. If you're a coach or you are a parent who doesn't know much about disordered eating, who doesn't know much about really all the other unhealthy behaviors that we'll talk about briefly, you want to get educated. You want to understand what's going on. You want to know what you're dealing with before you start saying things or maybe saying recommendations that may not be all that effective. And then for athletes themselves, they should stay hopeful. They should try to understand if there's particular things that are causing them to be a certain way, to, avoid or eat certain foods or not eat any foods at all. They shouldn't be afraid to seek professional treatment. Again, not being afraid to reach out, focus on how they're going to feel once they are better, and trying to understand that, no eating disorder is worth not only significantly impacting your life, but also, worst case scenario, losing your life or putting yourself at a risk to lose your life. Okay, just to go through these for sake of time, I just want to highlight again, just point out some important things related to these. So another unhealthy behavior in addition to disordered eating that can exist includes substance abuse. Substance abuse, we define that as a maladaptive psychoactive substance use pattern indicated by two patterns of use. There can be continued use despite having a persistent reoccurring problem. So what that means is that this person is constantly using the substance. There can be recurrent use, situations where use is physically hazardous. So what that means is they don't use it continually, but instead they're using it during specific moments that, again, might be causing significant harm to them in those particular moments. When you think of substance abuse, you think of things such as alcohol and steroid use, particularly in athletics. That is where most of the research has been done. You look at the research that's been done on both. You talk about alcohol use, 55 to 92% of high school athletes and 87 to 80% of college athletes use alcohol. So especially looking at high school athletes, that's a very high range, and that's a very, you know, uncomfortable range, particularly when you start thinking about all the effects of alcohol that has on athletics and on the human body as they perform in athletics. In performance enhancing drugs, when it relates to that, reported use by 5% of high school and college athletes, 40 to 60% among elite athletes. Look at that huge jump, right? So, you know, you start thinking about all the social pressure as a potential risk factor for why people get into substance abuse. That's a huge problem at professional sports. And a study that's not all that recent, but still relates to some of the research that's out there now. 1 in 16 high school students used steroids. So again, that's problematic. One of the many reasons why, particularly in athletics, alcohol use is problematic. College athletes are more likely than non-athletes to abuse alcohol and experience alcohol-related problems. You know, there's a couple of reasons for that people believe. Most of the reasons are tied into the fact that there are just these pressures that they face, and athletes try to use alcohol, at least their interpretation, as some sort of escape, which is not always, again, many times at all, really a healthy option, particularly when they are harming their body in excessive amounts. Binge drinking, you know, it's one thing to consume alcohol, particularly if you're of age and you consume it appropriately, but binge drinking is very problematic, particularly because a lot of athletes normalize, you know, parties, normalize the possession of binge drinking friends. So it's kind of like an ongoing self-fulfilling thing where college athletes normalize, you know, that much drinking, and it becomes just a part of what they do. And again, that could lead to some significant disorders throughout the way, and especially a lot of addictive behaviors, and really other things such as negative consequences regarding decisions, becoming injured. And something I want to point out that's interesting is if you look at that third bullet point, the use of alcohol by male athletes is higher than that of non-athletes, but no significant difference exists between the use of alcohol by female athletes and non-athletes. So although, you know, the biggest difference is on the male side, still overall, even if athletes are using alcohol just as much or more as non-athletes, they are still more likely to overdrink, to binge drink, to party, and again, party in a way that is harming them and causing more negative consequences. So they need to be, more than other populations, really careful of their addictive tendencies and their the things that might happen to them as a result of their addictive tendencies. Couple important things to note about steroid use. You know, it's pressure. You know, it's ultimately the pressure to gain an edge in their preferred sport. You know, and what's really sad is, you know, you look at teenagers and adolescent use and steroid use, a lot of that decision is coming from their perspective of what they believe takes to get to the elite status, right? They want to get an edge. They want to be the best of the best. So they're using certain things, in this case, steroids, to put themselves in that, you know, in that conversation. So thinking about alcohol as a drug and thinking about steroid use and all the other things that, you know, we have plenty of other things that we can talk about, but obviously we don't have time to talk about everything. Let's spend just a little bit of time talking about the reasons why athletes may do this. And I touched upon some of these reasons already. Of course, there can be physical reasons, performance related, rehabilitation related, just wanting to look overall better. You know, you saw that in the second video we saw with Dr. Dana Volker. She mentioned that one of the stigmas, or was just one of the stereotypes that has really preceded and been around sports for forever, and still in some ways continues to be, is that males typically will try to get bigger and females will try to get thinner. And although many times, really all the times, that's not always the case, or why that's appropriate, or that is appropriate, it's still, you know, embedded in the culture of sports. So again, it's no reason that people feel the pressure looking at those stereotypes, some of these other reasons, to do some of those things that they do. Very psychological reasons. People are overly stressed. They want a type of escape. They want to feel more confident. They want us to feel better about themselves. For some people, it's a thrill-seeking behavior, and they enjoy that. But again, with certain people who enjoy thrill-seeking behavior, sometimes they have a misinterpretation of potential consequences. They look at intrinsic rewards. Maybe it makes them, look cool among their peers. It makes them seem as if they're going to get some sort of, recognition from others that they wouldn't otherwise. And then they just, worst case scenario, maybe they can't control themselves, right? It's something that they significantly lack in when we're talking about self-control. And if we're going to categorize performance enhancing drugs, and I know we've kind of just used steroids as a blanket term at this point, but when I said steroids earlier, we really were talking about anabolic steroids. We have the categories of stimulants, narcotic analgesics, and anabolic steroids, which again is what we were talking about earlier, beta blockers, diuretics, peptide hormones, and analogs. And it's important to note that sometimes as part of someone having a particular condition, they are taking some of these things. But when someone, again, takes these outside of a prescription, outside of, general health, just for performance, hence the name performance enhancing, that's when we start to see really our significant issues come through. So just looking at some of the things that you might see that are probably most commonly used in sport. Of course, these are some negative health effects. I don't think I need to get too far into the effects here. I think we know these, whether it's just from knowing them ourselves or from other classes, so you have there for you to look at. And then when we talk about recreational drugs, people that are taking certain drugs for not only for performance, but also just, recreationally on their own, we can see things such as mood swings, distorted visions, decreased reaction time, and changes in blood pressure and other physiological functions. And when we start encountering problems where we want there to be a prevention and control of substance abuse, we do things such as providing a supportive environment. Again, that education piece is huge. Sharing the fact that, again, the consequences are significant, sharing the fact that, there's a level of unfairness, and that worst case scenario, substance abuse, regardless of what the substances, can lead to fatality, right? Can lead to death. So again, that's an important piece of information. Setting a good example from a team approach, coping skills, that becomes important. And what's becoming more relevant is the use of different web-based programming to document different things, document progress, and again, just further help in that education piece of everything. And the last, or one of the last unhealthy behaviors that we'll discuss is addiction to exercise. So, maybe this is something that some of you haven't talked about before or really thought about before. But part of being an athlete is understanding how and when to recover. Those that are negatively addicted to exercise, right? Because there can be a positive addiction, a healthy habit that is very much a thing. But when someone is unable to, balance exercise, balance their athletics in their life, where it starts, becoming something that's taking away from other parts of their life, and they're significantly losing out on other parts of their life, then we start to see a negative addiction. Also when you have things like overtraining and burnout, which we will talk about on the back end of the presentation, that is what's seen as a negative addiction to exercise. There can be different levels of dependence. Exercise can be seen as a primary dependence or as a secondary dependence. And when we focus on negative addiction to exercise, we see things such as a need for increased amounts of exercise, so you don't give yourself enough rest, anxiety, fatigue start to build, larger amounts than was intended. So in other words, someone goes into a session planning to train for an hour and a half, they end up spending 2.5, 3 hours exercising. They can't control themselves. the time that they're devoting to exercise increases over and over again in a very incremental period. And again, exercise is something that becomes a priority over other aspects of life, family, friends, other loved ones, school, work, and they start to, again, lose performance, lose attention, even lose precedence into those other parts of their life. And again, although similar to some of the other things we've talked about, although they realize they have a problem, they continue to do so at an unhealthy amount, regardless of their ability to acknowledge that they need help. So what can we do to prevent this type of negative addiction? Rest is important, especially, scheduling rest days, not saying, I'll rest when I need to, but instead actually making a conscious effort to make sure that rest is taking place. Working with partners. I know it says they're slower partners, but when we say slower, what we really mean is working with partners that can help pace you out. Even if it's not every time you train, it would be valuable, again, to work with people of different levels to make sure that you are not constantly hurting yourself, constantly growing that addiction. And that kind of goes into, if you are in significant pain, there's a clear difference between discomfort and pain. If you are significantly injured, you have to stop exercising. You have to at least exercising in the way that can further injure you. You have to give yourself the amount of time to heal. Mix in intensities, mix in different things. Don't always do the same type of modality when you train. Understand your goals, understand what exactly you need to do to achieve those goals, and understand that, again, rest is an important part of those goals. And again, going into just setting realistic short-term and long-term goals, and not putting yourself through a situation where you don't understand why you're meeting certain goals and you start getting frustrated with yourself. And again, even forcing yourself to further feed into your negative addiction. Not to breeze through these because they're still really important topics. But again, just for sake of time, I'm going to move rather quickly for them. Unfortunately, we've seen, sexual harassment and abuse grow tremendously in sport. So the thing that needs to happen ultimately moving forward is, in places that you work at, the thing you can do as a future healthcare provider, sports psychologist, whatever you want to do, whatever your intention is after this course, is making sure that this topic is one that is not ignored at your workplace. And this is one that has significant value in, the policies and the plan to, call out people that act in this type of manner, in types of behaviors that or overly sexualized and inappropriate verbal, nonverbal, and physical actions. So important to be able to discuss these things and be able to stay away from, again, behaviors that are making people uncomfortable in this manner. And I think these policies that I keep referencing need to, again, incorporate a team approach. So particularly when we talk at the high school level, these are policies that parents should be aware of. Obviously, everyone that works, athletes themselves, even sexual harassment among teams is something that we see, unfortunately. So again, this is something that needs to be confronted and not shied away from. And there needs to be a constant ability to re-educate and retrain people when it comes to this topic. And then, in sport, you see things that are, fist bumps and high fives, and, a coach can put their hand on someone's shoulder and not be considered sexual harassment. That is true, but ultimately there needs to be good communication among what's happening among the people that are being involved in the process. And at the end of the day, nothing should be done that's making people feel uncomfortable, particularly when it comes to sexual harassment and abuse. Gambling is a problem, particularly now when a lot of states are legalizing gambling. I think one of the issues, and this is really interesting, the text talks about this a little bit more in detail, But when there is some gambling that's even taking place from on the adolescent side of things or the collegiate side of things, certain parents and certain significant others react to this with the false, and I say false because it's something that they shouldn't think, but they do, with the mindset of, oh, it's not drugs, right? It's only gambling. They'll be okay. They know how to control it. Again, those are all really misconceptions, and that kind of thought process can be really harmful to the individuals that actually need help and are trying to get through this process. Okay, we're almost at the finish line here, so just bear with me. So just want to wrap up here, just making some comments on burnout and overtraining. Of course, as pressure to win increases and training increases without perhaps consequences of success, that leads to people constantly overtraining and perhaps burnout can take place. Burnout can really, again, it takes place as a result of overtraining, and just keep in mind that overtraining is not necessarily, well, it's not the same as periodized training. So it's one thing to push yourself extremely hard, go through high intensity loads, but also remember that rest has to be put into your training. When there is no rest periods, there's no low intensity periods, then you start to see, again, those overtraining elements. And burnout, we define burnout as a physical, emotional, and social withdrawal from informally enjoyable sport activity, which can be characterized by things such as, pure exhaustion, both emotionally and physical, reduced sense of accomplishment, sport devaluation, meaning that the athletes that are sustaining burnout no longer really value that sport as much as they used to. There can be chronic stress, motivational orientations, and changes in the athlete that can lead to burnout. We've kind of talked about these, no need to rehash these characteristics. Definitely no time to discuss these here, but your text goes into much more detail of these 6 models of burnout. And remember what models are. Models are essentially, similar to theories in that there are ways to try to explain a certain phenomenon. In this case, it's burnout. So just know what these are, spend some time with them when you read about them in the text. But, we just don't have a lot of time to get into them right now. Here are some more signs and symptoms that are more specific. Sleep disturbances, appetite losses, increased tension, greater dejection, again, not being involved as much, feeling as happy as you once did when it comes to that particular sport. Mood states can change, higher levels of stress, negative mood states, poor levels of concentration, negative states become greater overall. No surprises there. One of the last things I'll bring up is there are a couple tools that are used to measure burnout. I'm just quickly going to go through the most popular ones. We have something known as the Maslach burnout inventory. This is a reliable instrument. In this case, it's a questionnaire. When we talk about questionnaires having inventory subscales, what that means is that there are different groups of questions in the questionnaire, and those groups represent subscales, so sort of like different parts of the questionnaire. In this case, the Maslach burnout inventory represents the subscales of emotional exhaustion, depersonalization, and personal accomplishments. Again, things that do tie into what we've been talking about with characteristics of burnout. We also have the athlete burnout questionnaire. This one similar to the Maslach burnout inventory, but the subscales are changed a little bit. So now we have emotional, physical exhaustion, reduced sense of accomplishment, sport devaluation, still somewhat similar to what we saw earlier. We see burnout in sports professionals, so not just the athletes themselves. This can include certified athletic trainers, officials, coaches, fitness instructors, administrators, PE teachers, sports psychologists can be victims to burnout as well. There is information on each of these groups in the text, but I just want to spend some time here on burnout to athletic trainers because, again, I am an athletic trainer. Athletic trainers, that spend a lot of hours, they're expected to be at their workplace for a lot of hours to the point where it's taking away from their ability to be around for certain family events, spend time with family, friends, de-stress themselves. Because remember, for every athlete that comes in that's stressed, that has an injury, the athletic trainers that work with them are taking on that stress. So again, that's just, that's caregiver stress. And that's something that's very significant in the profession. When certified athletic trainers, don't have a clear expectation of what coaches expect from them, what practices they should cover, what sports they should cover, where they should be. Maybe there's some confusion as to exactly what they should be doing or where they should be present when there's multiple events going on, and coaches expect, this becomes very difficult when there's one or two athletic trainers, and certain coaches expect something every single time, even despite the fact that there might be multiple sports going on at once, multiple athletes. That can be very difficult. Confrontations with parents and coaches, that's always stressful, particularly if it's negative. And when we talk about type A personalities, these are individuals that want to be in control, right? Want to set the precedent for what coaches can and cannot do. And depending on the coaches that are on the receiving end of that personality, sometimes that can work very well. But if you have other type A coaches that like to be very controlling themselves, then obviously you're running into a clash of personalities. So that becomes very stressful indeed. So for these sports professionals and really athletes as well, things that need to be encouraged to prevent burnout and prevent overtraining, which leads to burnout, includes rest. I cannot express how important rest is as it pertains to athletes. And when we talk about sports medicine professionals, obviously we're also discussing mental rest. That's important as well. Communication of your feelings, knowing when you feel overwhelmed, particularly to those that are important in your life. Relaxation, timeout breaks, mental health days, that's gotten a lot of more publicity over the last couple of years, and for good reason. Autonomy, supportive coaching styles. So, as a coach, you want to empower your athletes, and even as an athletic trainer, you want to empower your athletes to take an active role in their own training, in the case of athletic trainers, in their own rehabilitation, so that you don't always have to, you're always there, particularly from a supervision standpoint, but you don't always have to be the one always leading the charge, so to speak. You can encourage others to step up to the plate and, take some of the weight off your shoulders, for at least for a short period of time. And of course, short-term goals, focusing sometimes on the smaller details, not always on the bigger picture, is important, again, when it relates to burnout. So again, I know that was a lot, and those 3 chapters are probably some of the longer chapters in the textbook. So, hopefully you watch the entire lecture video. But the good thing about having these recordings is that you can always go back, at any point, pause, take notes where you need to. Maybe if you're unclear about something that I said, you want to re-listen to it, you can do that as well. So hopefully you hung with me at this point in the semester. We're close to the finish line. So, just hang in there, tough it out. And, I promise, as long as you've been doing what you're supposed to have been doing throughout the semester, you'll be okay.